There's one more decision that every person should think about, Matthew. We call it the imagine this scenario. Imagine that you've had a sudden event, such as a car accident or a sudden illness, that left you unable to communicate. You're receiving all the care needed to keep you alive, but the doctors believe there's little chance, and by that I mean less than 5%, that you will recover the ability to know who you are or who you're with. And I'm just going to stop. I don't want an answer here. I just want you to tell me in your own words what that situation is saying. What does it say to you?
That your chances of recovery are not good. Not likely.
Can I clarify, when you say recovery, what do you mean recovery?
Well, it kind of goes back to what I was saying, when I was saying I'm not sure exactly what's coming out of my mouth right now, but it's kind of how I'm feeling. I don't know 100% what recovery would mean or what I would need that to be.
In this situation, recovery means, you might be living, but you would not recover the ability to know who you are or who you're with.
Okay.
So I want to just clarify that that's what this scenario is saying.
Okay.
You might be living, but it's unlikely you would recover the ability to know who you are and who you're with.
To me personally, that means that I'm done. That I'm not going to be living any kind of life that I would consider to be quality anymore. That I'm essentially just being kept alive by a machine or by medicine, modern day medicine, and that would be when my family would need to start saying goodbye to me.
So this is Anna, where the role of a healthcare agent, the doctors would look to you. And that's why this conversation is important, because you're not able to tell Anna at the time what you're telling her right now. Anna, do you have any questions about the situation? Does it?
I do. I know there's a lot of different situations, and the one that we're talking about in particular, basically the doctors will be able to tell me exactly what you've explained to us, and then I would be expected to carry out Matt's wishes. At the age he's at and the age of our boys, the first thing that comes into my mind would be, but if there's a chance, what do you do? If he were, much older, I think it would be a different decision. So it's just good to understand at this point in our lives what he would want out of something like that versus 20, 30, 40 years from now, what he might want.
So let's, before we even talk with Matthew, I think he was kind of moving toward a decision already. So Anna obviously has some concerns about, if there's a chance. Tell us again why this situation, why you use the phrase, if I'm in this situation, I'm done. Tell us again why you said that.
Well, 5%, is not, I wouldn't consider it good chances of any type of recovery. It's not even in the realm of what I would consider to be good.
So let's talk about that a bit.
Okay.
What would be a good chance? What numbers would sound better to you? And again, Anna, this is helpful. Just 5%, less than 5% sounds not acceptable to him, doesn't it?
Right.
But what number would be more acceptable? That might be helpful for Anna to hear.
Well, and I was thinking about the boys and everything too. If we're going to throw a number on this, I don't know, 50-50 maybe. If there's a coin flip that it could work out, right? I think that would be reasonable to at least, give it a chance or give it a go, to try anyway.
And so you can see, Anna, there's a big difference between 5% and 50%. Now, whatever the doctors would be telling you, this at least gives you some idea of what Matthew thinks is unacceptable and what would be better odds from his perspective to try and continue. Yeah.
Yep.
Do you have other questions, either one of you, about the situation?
Well, are they able to really give you a scenario? Like he's got, I mean, how do they ballpark percentages like that?
Yeah. And you know, nothing's certain, right? That's why we're using kind of general terms here. Nothing's absolutely certain, but this scenario is painted so that you understand that the doctors have done their tests, they've gotten second opinions, and the best medical judgment is that there's less than a 5% chance you would recover the ability to know who you are and where you are. Notice how I'm emphasizing that piece. So please trust that, you know, they wouldn't make this judgment without having done appropriate tests and evaluation.
Okay. Yeah, I would just not want to put us in a situation where we're throwing all of these resources, our money essentially, at a scenario that does not shape up well. You know, that's where my head is at on
Right.
that. Yeah.
Does that help with your, I mean, you might have a different opinion, but does it
Right.
help hearing him say it, Anna?
Yes, it does. It does help to hear it with that broad of a range, because I would have a different opinion, but this is about what Matthew wants, so that's what I need to understand.
Yeah, and you both talked about the fact that you can disagree.
Yeah.
You've seen it in your families, but the gift of love is, what does Matthew want in this situation? And then Matthew will need to do the same for you. Any other questions about this situation or thoughts before I repeat it? So in this situation where it was a sudden event, car accident or illness left you unable to communicate, you're receiving all the care needed to keep you alive, but the doctors believe there's less than a 5% chance you'll recover the ability to know who you are and who you're with. So in this situation, I'm going to paraphrase, you would want to stop medical treatment if there was less than a 5% chance you would recover the ability to know who you are.
Yes.
If it were closer to a 50% chance that you would recover, then you would want to continue.
Yes.
Did I paraphrase what I heard you say correctly? On it, and I know that you've been listening closely. Do you think you can honor that decision that Matthew would want you to make for him?
Yes.
Yeah. Doesn't mean it wouldn't be hard, right?
Right.
Yeah.
Yep.
Yeah.
Would hope to never be in the situation, but
Absolutely.
now that we've had the conversation, I understand, and we've talked about this type of thing before, so I understand generally what he would want and why he would want it. So,
Okay. So this is kind of
but now to
confirming.
formalize it, it helps to confirm it.
Right.